This mother is complaining of continued perianal itching even after 2 doses of deworming. And the mother has already brought the picture of worms from the perianal area of the child. So from the picture it is very obvious it is pinworm. In some places it is called threadworm, basically because it looks like strands of thread, and scientifically it is called Enterobius vermicularis. And now what are the symptoms? The symptoms basically is itching, and as this mother saw, one may see the worms also. In addition, there can be erythema and abrasions because of the scratching, and sometimes the worm may migrate to other orifices, so it can cause vulvovaginitis and urethritis, etc. So those are the usual symptoms. So why there is itching? That is basically because this worm comes out of the anus to lay eggs in the perianal area. Sometimes because of the itching, the worm may burst open and the eggs will spread there and stick to the perianal region. And unwashed hands or thumb sucking or nail biting will cause it to go into the mouth of the baby, and then reinfection will ensue. So that is how it goes on getting infected. And in addition to our hands, it can stick to our fomite, our clothes, or whatever the bottom is coming into contact with. For example, if you are sitting in the floor, it will stick to the floor. So naturally, the adults who are taking care of this child also may get the infection or sort of infestation. And in environment, the egg can remain for few hours to days and sometimes 1 or 2 weeks even, depending on the environmental conditions. Now the eggs that are ingested, that goes into the duodenum, hatches, and then migrate to the terminal ileum, cecum, and possibly the ascending colon, and mates there. And immediately soon after mating, the adult males die off. So we never see adults out of the anus. The worm that you are seeing in the perianal area is always the gravid female. And in the intestine, it is demonstrated in appendix also, but appendicitis is unlikely due to pinworm infestation. Basically because it is a free-living worm in the lumen of the intestine, so it will not cause inflammation of the intestinal wall, so unlikely to cause appendicitis. So that is why, in spite of it being demonstrated in the appendix, appendicitis is unlikely because of pinworm infestation. Now how will you diagnose? Eosinophilia you will never see. IgE it is never raised, and stool examination also will be negative because the worms are only sticking onto the perianal area, so it is not passed out in the stool. So the best way to diagnose will be to apply a transparent cellophane tape in the perianal area and then stick the sticky surface onto a slide and then examine under a microscope. So that will reveal the eggs. Now, treatment, theoretically, suppose you don't treat at all, if you prevent reinfection, the worms that is already there will die off in about a couple of months. So you will get a natural cure. But then, in real life, reinfection is the rule. Because as I said, because of scratching and contamination of the clothes, you get secondarily infected. So to prevent the infection becomes a priority. So what can we do to prevent the infection? So we can see in this slide what are the things that is to be done to prevent the infection. Now in this slide you can see cut nail short, hand wash after toilet and before taking food, discourage nail biting and thumb sucking, change clothes daily, and wash clothes, and after washing you have to sun dry it, dry in sun for a whole day. Washing just in warm water will not suffice, and do not sit bare anywhere because the worm egg will stick onto that surface. And in that respect, it is better to avoid European closet, because in the rim the worm eggs will stick and will infect the next person who is sitting on that commode. And for bed making, when you are changing linen and shaking, you do it outside the house. Take the linen outside and then shake. Otherwise, it will aerosolize and infect the other person in the room air. That is, if you aerosolize, it will go into the throat through our breath, and from throat you will swallow it and it will cause reinfection. Now, if you have to scratch of course you will have to do. That is to be done over the cloth, so that your finger will not get contaminated, and the cloth, as I said earlier, must be washed and sun dried a full day. And when you are planning treatment, treat all the family members together, because the other family members may also get infected because of the wide distribution of the sticky eggs. Albendazole is the treatment of choice, and it has to be given 2 weekly for 1 or twice, because reinfection is the rule. So you treat today, after 2 weeks, and then after 4 weeks. Itching is at least partly immunological, which means even after you take care of the infestation, even after the worms are dead, you still go on itching for a week or so. So to cut short this itching, we can apply a mild steroid in the perianal area. What I do in my personal practice is I do advise a combination of crotamintone and a mild steroid, because crotamintone has got antipruritic properties. But this is not a standard recommendation. Now, here in this case, the parent has brought the worm, which means the elimination of pinworm is not complete with the treatment. Most probably it is because of the reinfection. So the methods to eliminate the reinfection, as we have seen in that slide, must be reinforced. Suppose it is actual treatment failure, then the alternate drug would be ivermectin, which we can use once, and then after 2 weeks, and then after 4 weeks at 200 microgram per kg per dose. But as per literature, ivermectin is an inferior drug as compared to albendazole. In my personal practice, what I do is I apply albendazole suspension over the perianal area about 1 or 2 hours after the child has gone to bed. That is when the parents are going to bed. That will take care of the worm that is coming out to lay eggs there. If a pregnant lady is infested, then the ideal thing would be just wait out, prevent reinfection, so that the worm will die off in about 2 months. But suppose you decide to treat, it's always better to use mebendazole rather than albendazole, because mebendazole is not absorbed to any significant extent. Now, regarding the government policy of giving albendazole periodically for children below 18, whether that can take care of pinworm? Yes, it can, provided you totally rule out the possibility of reinfection. Then single treatment, single dose should be able to take care of pinworm. That's all I have to say about pinworm infestation. Thank you for watching.